I have a question. Are you one sneeze away from a COVID exposure? Well, this is how it happens. Droplets everywhere. Before we get started, let's assume that all the people with probable COVID-19 or coronavirus are following the advice of physicians and CDC to self-quarantine. And we're not going to be talking about these people because they're in their homes. We know the CDC recommends that people with possible COVID should wear masks in their household to reduce the risk of transmission by droplets. So why not take this lesson to the community? Many people are going to grocery stores, pharmacies, takeouts, and some are still going to work. Given the rapid rise in number of cases, the odds are that someone who is out and about in these public areas is already infected and maybe just about to infect you. I don't know if you've been to a grocery store lately, but it seems to me that people are a lot closer than 6 feet apart in general in the grocery store. In addition, people go in and out constantly, so the odds of the place being laden with virus is on the high side. So let's talk about going to the store. People can't stay in the house all the time, they have to go to the store. But is there a way that we can make the store a little safer for everyone, including the workers? We understand that people with coronavirus or COVID-19 may be contagious before their fever. They may have no idea that they are infected when they're out in the grocery store. What if one of those people who is infected and has no idea they're infected happens to accidentally sneeze while they're in the store? 6 feet of droplets go everywhere, on other people, on the workers, on the patrons, on the food, on the produce, on the cans. It's everywhere. We know that this is primarily how the virus spreads. The COVID-19 transmission shown here by the Center for Infectious Disease and Policy shows over time how the droplets spread and how someone who is a good distance away, the one represented as C, will get a very minor exposure when he's that far away from the person who sneezes. Anything closer, there's problems. Now let's think about the person who sneezes in the store. What if that sneeze occurs and the patient had a barrier over their face? Hashtag keep your droplets to yourself. In the second picture, we show a tighter barrier, keeping more virus to the person's self. Better barriers mean better containment. Okay, now, same sneeze, same circumstance. Everyone's wearing a mask. The person sneezes and the droplets don't fly all over. They stay right in the person's mask, therefore decreasing the risk to all the people around him. In addition, it's decreased risk of contact on your produce, on your cans, on everything you plan to touch in the store. The problem is everyone has to do it or it doesn't work. Let's say this worker and these two patrons, they're doing what they need to do, covering their faces, protecting others from their possible droplet transmission, just in case they cough or sneeze. But one patron says, "Hey, I'm not sick. I don't feel like covering my face. That's a waste of time. I'm not doing it." And then he accidentally sneezes, his COVID positive sneeze, all over the produce, the cans, the other people who are protecting him. All of those things are going to be contaminated, even the people with the masks. Because when you're wearing a mask, what you're doing is protecting others from your sneeze, from your cough, from your respirations. The nicest thing you can do to someone who's covering their droplets is to cover yours in order to protect them from you. Hand washing is still going to be essential. You're never going to know who is actually. Remember this as well. The barrier you put on your face when you go out is also to protect you from yourself. Let's say the COVID guy who doesn't want to wear a mask is walking down an aisle, picks up a can of tomatoes that he thinks his wife wants him to bring home. Well, someone just sneezed on that can not 1 minute before, as they walked down the aisle and checked it out and decided they didn't want it. Now he's contaminated his hand, and now his nose starts to itch. So he rubs his nose with his finger that's already contaminated and has now introduced the virus into his nasopharynx, self-contaminating and potentially causing himself to become very ill. What if that same person had wore a barrier? When his nose started to itch, he would put his hand to his face and he would touch the mask, thereby protecting himself from the droplets that he just touched on the cans. Much better. Now, there are no guarantees. What I'm proposing here has got potential benefit to reduce the number of infections that are going around, especially when people are in stores, pharmacies, takeouts. If everyone wears the mask, everybody will be keeping their droplets to themselves and will be much less likely to transmit the virus when the people are out. This is not to do in lieu of social distancing. Social distancing is important. I'm talking about situations where you wind up less than 6 feet away from people, like in stores, pharmacies, and restaurants. If you're outside, if you're sitting far away from someone, this is not as important. You could still wear the mask when you're social distancing, but it's not as important than when you're in these places where people are continually going through all the time, that people are shelving the stuff. Stuff is happening all the time. The store owners are currently not telling these people that they should be wearing masks while they're working. I think that's odd, and that should probably change. What if it reduces exposures by 50%? What if it's only 25%? What if it's 100? What if it's only 10? It really doesn't matter. If there's any benefit at all, there is no risk. There is no cost. There is just benefit. Keep your droplets to yourself. We should make this a community effort. And know that nothing is perfect. This virus is very contagious. No one knows who will get it or how bad it will be when you do. My perfectly healthy 26-year-old coughed up blood after a very rough case of COVID. Let's try to reduce the spread and potentially save lives and long-term health by keeping our droplets to ourselves and covering our faces up anytime we are going to be in a store. Healthcare workers are risking their lives every day to care for the infected. The least you can do is try to stop the spread. To do that, you need to stay inside as much as possible. Keep your social distance more than 6 feet at all times. Wash your hands and surfaces continuously and wash them vigorously. And cover your face when in stores or working or cooking for others. We're going to need total buy-in. We're going to have everyone start to cover their faces. It's not too much to ask. Spread the word, not the virus. And don't think that you have to wear a medical mask. You don't have to take masks away from doctors. You just have to cover your nose and mouth. Be creative. Thank you so much from the people who have adopted the 100% compliance rule already. We are frequently very busy, and our lives are going to get very difficult in the near future. We're going to have to watch people die. This is going to be terrible for our profession. Please, do your best to decrease the spread and help this go away sooner. Thank you.